Hi everyone, and welcome to the second episode of Your Best Self. I'm Dr. Stephen Davidowitz, also known as Dr. D. Is it too late to say Happy New Year? Well, who cares? Happy 2022 to you all. We are all deserving and excited for a fresh start to a new year. Since our first show, a lot has happened. It's been really a pleasure to spend the holidays with my family. And I thank you all out there who watched our first show. We've gotten a tremendous response, so we hope to be here for the long haul, giving you the tips and tools to make today your best yet. So be sure to follow us and reach out on social media at Your Best Self TV. And let us know what matters to you, what you want to hear about, and where you can use a little TLC. So for the next 30 minutes, hang out, relax, and let us share some tips, inspire, and entertain you. Our first guest, Dr. Pamela Gallagher, has over 30 plus years of experience and is a board-certified plastic surgeon. Dr. Gallagher integrates surgical and non-surgical procedures to provide effective and desirable treatment plans with long-lasting, natural-looking results. She joins us now. Welcome, Dr. Gallagher.
Thank you. It's lovely to be here.
The topic is great since more and more people are asking and getting Botox. As a cosmetic dentist, I know what Botox could do around a smile. But our viewers want to know, can anyone get Botox? And who should they be getting Botox from?
Well, I feel like any adult can get Botox. And if there's a question from a medical history, they need to make sure that they clear it with their family doctor. But, for instance, we won't give it to somebody who's pregnant.
Gotcha.
Okay. And who should do it? Well, you're asking a plastic surgeon that, and I would say only a plastic surgeon, but that's not really true because I've trained PAs. I'm training a nurse practitioner right now. And if they have a good aesthetic sense and they know the right way to approach a patient, I think people who, and there are other physicians, dermatologists do a good job. I mean, dentists do a good job sometimes. I don't know how many, but a lot, sure. So you really need to know who you're going to, what their approach is, what they have been trained and how they've been trained. And then I think you'll feel comfortable.
So do your research before you sit in that chair and get good results. Mm-hmm. There are some terms out there with Botox that I'm hearing for the first time, and I think our viewers have seen it, but they don't really know what it is. What is baby Botox?
It's kind of a made-up term. I'd have to do some research to find out really where it came from, but it describes a bunch of techniques that allow you to either be doing something from a preventative point of view, or let's say treating it less than classically, which would be with trying to prevent motion that's causing lines entirely. Okay, some people aren't comfortable with that. They want a little more motion in their face. I personally, when I get my Botox, I want to have expression, but I don't want the lines. So I get a little more than baby Botox, but maybe a little bit less than classic amounts.
Right. So keep it natural. That's where we're going with that.
That's where we want to stay.
Gotcha.
So if a patient comes in and says to me, I want it frozen, okay.
and freeze them up.
Freeze them up. But, that's part of the patient-doctor back and forth. I need to know what you want. My first experience with baby Botox was in a young actress whose director said to her, your eyebrows move too much. She came, what do I do about my eyebrow? I said, oh, well, we've got something wonderful for you. And just a little bit of baby Botox was able to calm it down enough that that her director was happy.
That's a great example. What is browtox, and how does that work? Browtox,
again, there's somebody out there manufacturing these terms, but they're a lot of fun anyway. It's referring to shaping the brow. Okay, so you have one of the evaluations that you have to make is somebody's eyebrows too low to start with? You have to be careful then where you're going to put the Botox. And sometimes what you can do is just raise the eyebrows, either the wings or the middle, 2 millimeters or so, just enough to open the eyes, make them look more bright. And so you're basically reshaping. And then you hope somebody didn't get bladed too low when they do their eyebrows. But that I can't fix.
What exactly is nutox?
Nutox is referring to the latest released toxin, neurotoxin. That sounds like a scary word, but and that's Jeuveau, which is a lovely product. And a lot of my patients are really, really happy. I find that it's, in some ways, it gives you a little bit more ability to vary what you're doing because of a special property it has of not spreading out from where you do the shot. So you can really pinpoint it. But you can do that with other of the neurotoxins that are out there, but you have to use a different way to do it. But
So interesting. Dr. Gallagher, thank you so much for coming in. How could my viewers find you? How could they come in for a consultation?
well, you can visit our website at islandplasticsurgery.com and arrange for a complimentary consultation, or you can visit our social media at Island Plastic Surgery.
That's great. Thank you again. When we come back, we chat revamping your living space just in time for cozying up for the winter weather. Stay tuned.